Hello, everyone. I'm just gonna pin our comment here. We'll be talking today COVID Convos, our series, just continuing to normalize the conversation around COVID vaccine fears and, apprehensions and answering some questions that folks need to be answered. So we'll come in, we'll talk to you more about that, just normalizing the conversation around COVID. Hi, Brendan. Hello, Dee. Here I come. I'm pinning the comment here. Hi, Dee.
Hey now, how you doing?
I'm doing all right. I'm just pinning the comment here and then we'll get started.
Okay.
COVID-19. Today. This comment pinning thing. The task. How's your day going so far?
Well, what I'll say is we're closing in on the end of it. That's what I'll say. It's not been bad.
I know. What I don't know. It's been like a gloomy / sunny day over here in my neighborhood.
I like it when it's like this, a little cloudy.
Yeah.
But I'm not trusting this after I read how the fires in the West were affecting the weather patterns here. I'm not sure what I'm seeing. You know what I mean? Like, is this cloudy really, or is this soot?
Or is it?
I don't know.
It is a little interesting,
It's been several days now. It was what, 2 or 3 last week, and then today, where
Right.
where the way it felt and the way it looked, it was different.
I agree. So I'm all set. I've pinned that. We can, as people join in, let's just kind of introduce ourselves.
Okay. Cool.
Mm,
You want me to go? I can.
I'll go first since, you're my.
Okay. Hold on. Your sound is cutting out.
Uh-oh. How about now?
You're good. You're good. And you can hear me okay? I have these headphones.
I can hear you perfectly.
Great.
Hi,
Then
my name.
thank you for inviting me today. I'm Dee McGreeny. I'm part of the Whitman-Walker Health family. Have been for quite a while, but I'm here today really to talk about my own experience around, looking at COVID, my own feeling, my own process.
Thank you, Dee.
Sure.
I'm Rama, pronouns she, her, and hers, and I work in the community health department. And as Dee mentioned, we're kind of here I'll be asking Dee a series of questions. The goal is really to discuss, individual experiences with the COVID-19 vaccine and COVID-19 in general, and then kind of talk through some strategic ways to outreach to people who look like us.
Yeah.
We are the ones that are most affected by this pandemic. So let's talk about it. So you guys have seen us here for the past year and a half. We've been in the space, community health department with our amazing colleagues and various guests just to kind of talk through general public health interventions, HIV, STI, and sexual health practices, care, social determinants of health, more specifically this pandemic, right, which kind of led us to building this robust social media outreach platform. So to get started a little bit, Dee, have a couple of questions for you here. Let's talk about who's getting vaccinated, who's not getting vaccinated. But before we get into all of can you please tell us a little bit about how you felt? Like, where were you? What were you doing when you first heard about this pandemic? And
Yeah. It's interesting. You sometimes know the things that are going to have a high impact on you in the moment when you see or hear them. And this was one of those times for me that I heard it, but I could feel myself doing mental gymnastics to back off what I was hearing.
Wow.
So the first few days, I mean, I'm a consummate news junkie, so I had been watching the European situation. I had been watching all of that and had heard what had, or at least some news that was coming out of China. But I was watching the hospital situation. I think it was in Italy, thinking, this is Washington, D.C. Maybe if I lived in another state or a state, I could say this might be a distant situation, but I looked at those people and said some of those people are going to get on airplanes and come here, or some people that are here are going to go there and come back. So that was a foregone conclusion that we would meet the virus. But I was also listening to the happy chatter that was coming out of our systems of medical information, not Whitman-Walker, but the general government stuff.
Mm-hmm.
And they were colliding with what I was seeing.
Mm-hmm.
So I was seeing a really serious thing, but I was hearing, no worry, no worry, everybody just calm down. So at some point, I sort of, for a few days, I think I bought the calm down part.
Okay.
But I was going on vacation that week.
Okay.
Nowhere, just home. But I had time alone to think and watch what was going on. And it was like, oh, this is real. The full impact, I don't even think I see that now, really. But
Right.
the impact of what we've gone through in the last year and a half, it did not come to me until I closed the door to my apartment on the 13th of
Of
March. Yeah. And said, I don't know when I'll be going outside in a freeway again. I knew that week that this was life changing. So,
and
yeah.
wow. Yeah, that's all those things. I felt the same things. But I will say that it wasn't as, again, the media, the gravity of it in the media was so much greater than the responses you mentioned, right? As like the public health response, the government response, where it's like at the time, like our leader, the commander in chief, it was like, like it was almost like, okay, are we fending for ourselves now? Like, I know that it's a government governed by the people, but whoa, like this. I was like, when is like, what's next? What are we gonna do? So
Yeah.
it was all of that. Actually, I had traveled in February, like to Brazil, ended up being the epicenter after we kind of got it together, but not even really. They just were far, far, far beyond us. And then, so yeah, so it was coming back into the country was just like, wow, like what are we getting into? I was ready. I got my reset for my vacation, ready to go back to work. It's spring. I'm ready for the springtime in DC, and springtime in your house is what I got.
Springtime in your house. That's exactly it. With all the, I mean, I feel like I must have been pretty well prepared in terms of services I would need to come to the house.
Hmm.
And some of that is having begun to think like an elder. You know what I mean? So probably a year before I realized, oh my, grocery shopping is harder than I need for it to be. And there's some people will bring it. Okay, so I had already gotten that in place. So there were some things I was doing that was already of
Oh,
great service to me,
so
so I didn't have to try and worry about, food and stuff.
right, complete opposite for me. I go to the store. It was definitely it was a life-changing moment, as you said, for us all in some way. Um, so yeah, so now, like I said, very, very, very relatable. So, hearing that when it reached to the States and the shutdowns, everything happening was just like intense because it was so abrupt. Whereas we could have built up to it because that wasn't our first time hearing about COVID, right?
Right.
So just that massive shutdown, everyone's like, oh, it's probably 2 weeks, 3 weeks. Wow, a year. So,
Yeah.
oh my God. So now let's talk a little bit more about like the vaccine, since when we were all like in that limbo moment as to what's next for us. Can you tell us like your initial thoughts about the vaccine when you saw it come out, and where are you now with it?
Ah. Well, I will be really honest here. the vaccine had a double-edged thing for me initially.
Okay.
Well, like, excuse me, but y'all already ready? That's my first thought. But then, please bring a little education to this thinking. I'm like, oh, so of course people are working on all these things all the time.
Right.
This is work that's been going on, and now we have something specific to place the work to. So
Okay.
I heard all that, but who could have foreseen that anything with any working possibility could be done when it was done.
Hmm.
But I did hear that, and I kind of held out with there's a meme of Miss Seeley from Color Purple sitting on her stairs, and
Hmm.
she's just sitting in a really pensive way, and she's right, and she says, "Y'all tell me when you get back," or something like that. And that was the way I was viewing it. I was like, okay, I'm gonna watch y'all, and then you let me know.
I was,
And the first couple of weeks when the vaccine was available,
mhm.
I took that stance. Like, I don't know how to get it, and I don't know where to get it. But my barrier was I have to leave my house now to go and get it. I had gone out for a flu shot because I thought, I gotta take
Gotta
care of
be
that.
that.
Got it.
Not
And
missing.
this, no, it was like, please, God, get your flu shot.
Hmm.
Vote. Those are the things that I went out for. And now it was the vaccine. And once it was clear to me that I could get it,
Hmm.
the hesitation was over because I knew that I could not resume anything that looked like life that I was relating to other people with, that I couldn't get. I was going to do it because what other shot did I have? I knew what I had in the house, and there's no guarantee that even in here, I live in an apartment building. So even in here, I knew I'm protected, but not as protected. I said, I'm doing this thing because that seemed like my shot to live. Yeah.
Wow. Yeah. All all relatable. All relatable thoughts of like like what's like how did you guys do this so fast, because we've never had to, I mean personally me, I've never had to live through this type of like with the vaccine. It's like even like being younger taking vaccines, those vaccines were developed, I'm assuming it's gone through this ethical process, and nothing that I had to experience as an adult where it's
Yeah.
like your decision, like, oh, so now you really have to look things up and see how this process works, like how did we get here,
Right. Right.
everything I've ever heard about vaccines, like in like the normalized conversation about the vaccine, not more so of the nitty gritty scientific aspect of it, has been that it takes forever, right? So then how am I supposed to change my mind in a snap? What does that look like, right?
Yeah.
Consider like history of like Black and brown folks in the healthcare system, not just in America, worldwide. So
Right.
so it's just a lot. So breaking through that barrier, I do think that for me was more so like living and protecting the people around me, and then doing the research myself. Right, being folks who work in healthcare, it was really really important to know that like beyond even our scope of work, we need to do the work, the research for ourselves, so we're comfortable. You
Yeah.
know, really like, and then that community buy-in is so important for it. As you mentioned, just to see what are you guys doing, what are y'all doing. So
Mm-hmm.
or
Mm-hmm.
I had all of those things, but after after I learned more about the authorized use, the emergency authorized use, all that, what it means, I was like, oh, this is for me. I was like, got it.
I mean, and for me, I spent time in the military, and you don't consent to any vaccines. They just do what they're going to do. Okay. So that was one experience with vaccination, and there was no education around what they were doing. They just gave it to you.
Mhm.
I, I was born not long after or during when polio was still a threat. So
Okay.
there was, in my childhood, I remember that discussion, and that fear was still lingering with people. Um, and then we had measles vaccines. Yeah. And so that was my first knowing participation in something that was aside from my mom being with me when I got a shot. They delivered that vaccine by sugar cube, God knows, to kids in their mouths. So supposedly the parents signed consent, took it back to school. But, we were kids. A lot of kids signed their own consent, frankly. A lot of kids did it several times because it was sugar.
Right.
So bad delivery mechanism in my mind. But that was in my head. I was like, you've already taken this shot. You've already taken a chance on this stuff. So this is the shot you're at being asked to take now.
Right. Right.
Yeah.
And I do think that like individual trust with whoever your provider is so important, right? To kind of
Yeah.
feel like you can have the conversation. And I know like for us, like in space that we don't feel that we have the autonomy. So those are like, you feel like there is an educational component that was skipped as far as how people are receiving this vaccine, that
Right. Right.
we retrace our steps and understand that like people are not saying, oh my God, no, but like even without really understanding their why, all the
Mm-hmm.
a lot of folks' whys we've turned into misinformation, conspiracy theories, and all that stuff. Like they've been given a platform essentially, and the healthcare system needs to find a way to combat it.
And they are, I mean, in the last few days, I've started to pay more attention to, in my mind, I had folks that are not being vaccinated in
Hmm.
one camp. And
Hmm.
those were folks that were, and I'm using these air quotes because I'm really rethinking a lot of this. But those were the folks that were experiencing hesitancy because of current or past treatment by the medical establishment. I had not really got my head around there's a whole nother crew of people that are right wing that are, they have whatever reasons that I have not dug into, but they're on a whole nother trajectory of not being vaccinated. I'm like,
Yeah.
okay. So the misinformation is almost colliding. It feels like one group is feeding the other, but the folks that are going to suffer the most
Uh,
are black and brown and poor people and old people. This is who's going to bite it and who has already bitten it around this.
yeah.
But at this moment, I'm concerned about, well, frankly, I'm concerned about the same people I was concerned about initially.
Forever. Like
Black and brown people are that if somebody does, that's my priority in this life. So
every
I will say that openly. That is who I'm looking at. And
yeah.
I don't want us to get it in our head that we're not a community, that we're not beholden to each other in some way. And to me, yes, it was about myself, but it's about my tribe, my mom, my sister, and then my tribe large. I cannot be the courier of a virus that will kill people. I just
It,
can't do
I,
it.
yeah, I can't. My health, my moral compass also, like, and even if at least if there was a situation where folks who are not getting vaccinated or they're just more concerned were still wearing masks or protecting themselves. But I've seen so many cases where it's just we don't know, right? So now it's like it's further putting people at risk, like even at like a greater risk than we just really don't know. So getting
Yeah.
the vaccine is not, it's more so of a preventative measure. It's not the solution. It's like it's the less than of it. It's a harm reduction method, which I
Yeah.
think folks are kind of like missing it. It's to avoid the fatality of the virus. And
Yeah.
so yeah, so we have Goldstein Bianca, hey, how are you? And Crochet Kingpin said the worry about how quickly it was developed is real. Hi, Dwayne. And said a lot of us took a wait and see approach, which is true. And I think
Yeah.
at this point, people in your community who you trust, have the conversations with them. So
And that's what I'll say. That's it.
yeah, how did you feel after the vaccine? Like, did you have symptoms? Did you, yeah, like,
Yeah. The first shot I was anxious, you know. I mean, I have some underlying health issues that I was like, oh, let's not trigger all the mess at once, okay? And
mhm,
had set my day aside to not feel well. I came home and I laid down for a little while, but I was like, you're begging sickness to come to you. Get up. So I got up and did some work and I felt fine. No sweat. And the days went on, what did I have? My arm was tender. I won't say it was sore. I've had flu shots that have
Hmm.
made my arm more long-lastingly sore than this shot did. It's a really small gauge, and you don't even know you got stuck, to tell you the truth. You
Right.
just, wow, it's done. The second time, the second go, um, a little, no, no, no. By the time I got home from the shot, I had fatigue, which is interesting to try to figure out what's real fatigue when you get past a certain age. Is like, am I just tired or am I tired? This was tired. And my concentration was shot. I couldn't concentrate on anything. So I just lie down, but I did not feel bad.
Okay.
Um, and just a little, I think a little cramping in my hands and feet. And that, my friend, was the end of it. Nothing else after that. And it's been months now. I feel good.
Okay.
When I go outside, do I feel like I can just rip the mask off and roll around? No. When I leave this apartment, I put my mask on. Excuse me, I don't know y'all. Okay? I keep my mask on outside if I see anybody. I keep it on that one ear, I pull it back.
That,
So I'm still doing that stuff. But do I feel that I will get sick and not be able to care for myself and not be able to get into a hospital? No, I don't. Do I feel like I can go sit with my mom if I want to? Yeah, I do. Can I be with my friends? Yeah, I can. Small doses, small, but there are some things that are have been given back to me.
when saying like how, knowing the vaccine brought you, like all of us, this sense of normalcy again, especially to be like that human connection, interaction that we've all been longing for, like how did that like make you feel?
Some of it, I this is the absolute honest thing. Some of it made me feel like, oh, I don't have anything to hide behind anymore. I'm a true introvert. So the idea that I didn't have to sometimes was a benefit to me. Like I can be in my safe space and still interact with people, and but I have a control now. So
Hmm.
some of that was, oh, I have to really go back out. But some of it was I used to, well, I have spent time in retreat, long periods of time in retreat. And there's a period when you come out where everything is bright, that your eyesight is almost restored because you appreciate, you have gratitude for what you are seeing.
Hmm.
And that's how I feel now when I do go out. I go for walks in the morning and I must look like a crazy person because I stop and I just look at the sky. I stop and I look at what I'm seeing. I'm not just yeah. I'm present for whatever's going on out there. So that uh, I wouldn't wish for this for that, but I'm
Yeah.
glad I got that. Yeah,
Yeah, it's a good feeling for sure. I agree.
yeah, I love that.
We kind of touched on this a little bit earlier in the conversation, just organically. Um, I'm going to ask again. As we know, the healthcare, so similar to most healthcare conditions, really predominantly affects, um, Black and Brown people of, ethnic minority groups and, things like that, gender minority groups. Can you share your perspective onto why you think that is? Like, even with essentially our communities being, in a sense, prioritized during
Mm.
the beginning of this vaccine rollout?
Well, some of the disparity I think is I would still point the disparity, ask people to look at class and race as they look at disparities within LGBTQ,
Mm.
and talk a lot about our young LGBTQ people, the need to socialize and be together. I know a lot of people live in group housing situations, and that's about age and class.
Yep.
And then for our older folks, I mean, I'm meeting people your age and above now that I'm seeing and talking with. And some of them did never changed anything. After this happened, it was like, yeah, I know that's going on, but that's not here.
Hmm.
And I don't know what the solution to that disconnect is. I mean, I think about it like I was here for 9/11, And there was a disconnect in this city on that day
Mm-hmm.
that I lived on a little past Capitol Hill. People that were going uptown were struggling. I was able to get on a 90 bus and go right across town because we we didn't think that it was about us. People were like, that's bad, but that's not happening here. And I think that's some of what's going on now, even though people are dying and sick. In some ways, some folks are used to living in zones where people are dying and sick,
Yep.
where there's threat, you know? And
Mm-hmm.
so it's hard to to talk to people about, oh, you don't want me to go to work, you don't want me to go to church, you don't want me to, oh, that's I don't know how to break through. I mean, I do spend a lot of time thinking about it. What do we need to break through?
We need to break through. That kind of brings us back to our last question here. Um, a little bit centered as a healthcare professional, what to bridge that gap. I know you say you don't have a solution, but what are some things that you can think about, like effective outreach about this vaccine to like the communities that need it the most? Like how can we reach those populations and bridge that gap?
Well, one, I want to just back up for a minute and offer my beyond measure appreciation to community health at Whitman-Walker. You guys, from the moment that this was an ish, you were there and there and there and there. The times I came in and I could see you all, it made me feel some normal sense that, oh, those are some of my people. Those are my people. And I know it had to be difficult, but I appreciate you beyond measure for doing the work you've done in the last year and a half.
Thank you, Dee. We
Uh,
appreciate y'all.
well, um, and then what can we do? What can we do? You're doing it right now. These are okay. So we talk to 3, 4, 5 people a day. Huh? That's 5 people that we hadn't talked to possibly. Every time we talk, even if it's totally lighthearted, even if it's not about anything, you come back to a thing. I don't ask people, have they been vaccinated?
Mhm.
I ask them, are they being safe? Do you know what it takes to be safe? Just, the ways we talked about HIV initially, don't shame, don't guilt, don't anything, but give people an understanding of how compelling the evidence is that they do another thing. So I sit here, I'm alive, I'm healthy, I got my shot.
Yeah.
That's what I can say is just to sit and be firm and to talk about it. It's not my private business anymore. I mean, you know that I was resistant. I about how to talk about this, but that was the thing that moved me in the end. It's not just my story,
Yeah.
you know. So that's
I
what I got.
I can absolutely agree with that because we do get in the space of, shame, like without having that empathetic lens and because even if I think about the way I operate on social media when it comes to the vaccine, just talking to my direct, connects and people who I talk to, my direct community, sometimes, you have to be mindful of the words that you use so that if you might be pulling someone back into that bubble of, like resistance and just like, further pushing them away without even knowing unconsciously. So it's really important to be mindful of that. So I think that is true. The conversation shouldn't be, did you get the vaccine? It's more so that's a great point. Are you being safe? And what does,
Yeah,
you know,
right. That's the best I can do. I can give them information about where. And do you want me to go? All of that support thing. But I can't come at you like, well, did you?
right, right, right.
No, I'm not. I think that's what's putting some people back.
Hmm.
I, all of us, it's going to take all of us to get this ship turned around. We're not close. I hate to say, but I don't, from what I'm hearing now, what I'm seeing now, we're not close. We're not as close as we might be, but we're closer than we thought we would be. I mean, I've been outside this summer, no kidding. outside without my bottom half of my face covered up, at least for
Right?
a little while.
The mo-
So,
the
yeah.
2020 summer motto, we outside. But I mean, break one of those. Like,
I'm outside, child. Yeah, and let me put on all my. I don't even care if it matches no more. I'm just, hey, I'm just
like,
wearing some clothes.
I've been inside for a long time. So now,
I tell you, when I was first able to get my hair taken care of, it was a crying situation. It was a weeping because I felt like one after almost a year, I thought my dreads are gonna fall out because I can do it, but I can't do it. Then I
mhm,
had some help, and I was blessed that. But when I got to go to the shop, that felt like one. I had somebody wash my hair for like half an hour. I was like, yes, marry me today. Okay, this is
get that.
great. But just to feel like ah, there was something normal going on. This
Hmm.
is a thing I do. So,
Definitely. Definitely. Thank you so much for sharing that with us, Dee, and taking the time today for your expertise
oh,
of outreach and community reach. As you said, the communities that you are most concerned with are the ones that I'm most concerned with as well, because we are the ones who are most vulnerable to anything. Every
yes.
health it points at us. So did you have any final thoughts?
Well, Dee never has final thoughts. When she does, she won't know it. So the thought is, who's ever out there, and for you too, Rama, I can't tell you how much love I have for you. I just really can't. And I love this community and I love my people dearly and desperately. And I want us all to survive. And for you young ones, know that we look to you to carry this forward. This is not just your story. Whatever it is you're doing, it's not you alone. It's a lot of folks. And we need to, in this moment, yeah, we can look at what we're upset and angry about, but we can look at how we can come together as people and move ourselves forward. This is our real challenge here. Is if we're not healthy, we can do none of this other stuff.
We can't. We
That's
can't.
it.
Thank you. Love is mutual, as you know. Thank you all. Thank you all for joining us today. And as you can see, if you do want to learn more about COVID-19, the vaccine, if you want to have these conversations with someone on a private level or anything you need, please make sure that you contact us at that number there at Whitman-Walker, 202-207-2480. That's our specific COVID-19 line. All things COVID. Just a quick question. We can support you whether you're a patient or you're not an established patient or client yet. We'll still take care of you. And please remember, although the CDC mask mandate that everyone can walk around without mask if you're outside, it is still high, especially if you are not vaccinated. The Delta variant is here. It is much easier to catch. It's at a fast pace, especially if you're not vaccinated. And most of the folks who are currently losing their lives to COVID-19 are unvaccinated folks. So just keep that in mind. Whatever it's going to take for you, if you're here and you need to talk to someone or your community, just do it. It's
Yeah.
yours. Yours. You have that autonomy. Like as Z mentioned, we have to be healthy to continue this progression of ours, as a community and as a people. And this is one of the ways. Just educate yourself. Be your own source. Do that, and we're just here to support you to get that. Thank you,
Thank you
everyone.
for this, Rama. You were great.
Thank you, Dee. You were excellent.
Okay, we'll see you soon. Take care, everybody.
Goodbye, everyone. Talk soon.
Bye.